In the meantime, as we're waiting for the last few people to join us before we get started, I'd like to welcome you all to our program today, Coping with the Lymphoma Diagnosis During COVID, hosted by the Cutaneous Lymphoma Foundation, the International Waldenstrom's Macroglobulinemia Foundation, and the Lymphoma Research Foundation. I'm Rebecca, and I'm a staff member at LRF and a part of the Leadership Learning Lab who has put this program together for you all today. We will get started shortly, and I just want to give a few more minutes for everyone to log in. While we wait, I want to go over a few features of today's program. Everyone is currently muted automatically upon entering, and this is to reduce any feedback or other sounds. Additionally, at the bottom of your screen and in the center, you will see a chat button. We ask that you use this chat if you have any technical issues, and someone will assist you from there. Additionally, if you have a question you would like to ask regarding the program, you can write it in there at any time, and we will get to those at the end of our program. Please note that the chat box will be public for our whole group. We will get to answering those questions after the presentation. Once we get through those questions, and if we have some time remaining, you can ask your questions directly. We ask that you use the raise hand function at that time and wait to be called on before you unmute yourself. The raise hand button can be found by clicking participants at the bottom of your screen. All right, it is looking like we have received a couple more people logged in. So with that, I think we are ready to get started to keep us on track for today. Again, thank you to each of you for taking the time to join us for today's virtual Coping with a Lymphoma Diagnosis During COVID program. Again, I am Rebecca, and I'm a staff member here at LRF and a part of the Leadership Learning Lab who has put this together for you all today. I would like to give a special thank you to our sponsor, Bristol Myers Squibb. We greatly appreciate their support to make this program possible. And before I turn the program over, I am honored to introduce you all Tammy Weitzman. Tammy is a clinical social worker at the Seattle Cancer Care Alliance in Seattle, Washington. She is a recognized leader in clinical social work for more than 19 years in the field of hematology, oncology, and allogeneic bone marrow transplantation. Her experience includes clinical care, program development, and consultation, specifically as it pertains to lymphoma patients. She also has a special interest in working with patients living with graft versus host disease following allogeneic transplantation. Thank you so much, Tammy, for joining us today, and I am excited to turn the program over to you.
Great. Well, thank you, everybody. I hope there's no issues logging on and everybody's comfortably seated, and I hope you enjoy the program. Let us start. Yeah, let's begin with the next slide. It's good to be with you all if you're just joining us. So today we're going to talk about your lymphoma diagnosis. And we're going to talk about the impact really of your lymphoma diagnosis, some of the common feelings and emotional concerns that people have once they're diagnosed and initiate treatment. We're going to talk about, issues such as anxiety and depression and how they manifest themselves. We're going to focus quite a bit on the interventions and modalities to address anxiety and depression specifically. That's what I see in my practice. That's what I hear from my patients and their families. And I think that that's what's going to be most helpful for folks. So we're going to look at some interventions and modalities such as behavioral activation, mindfulness-based relaxation modalities, and the role of psychiatry and spiritual health. In my setting, we call chaplaincy spiritual health. In other settings, it's quite simply chaplaincy. I want to say for a minute here that you may all be doing all of these interventions, behavioral activation, mindfulness, and but you may not know what they're called, or you may not even know that you're doing them. So we'll delve into them a little bit, and hopefully you'll recognize yourself and doing these modalities. So next slide, please. Okay, so, we're also going to lastly talk about coping with diagnosis and treatment during this exceedingly challenging time of COVID-19. And we're going to talk about the significant increase in emotions and depression and anxiety and uncertainty, and normalize those emotions as they should be. We're going to talk a little bit about your power and sense of control during this time, because most people feel they have no power or control during this time, that COVID has all the power, and the importance of remaining connected to one another in the outside world during this time. And then I'm just going to present a little bit on, the whole issue of staying positive versus remaining proactive. So there's a big difference between the two, and we're gonna understand a little bit about that. So next slide, please. Okay, so we're going to really begin now and talk a little bit about anxiety. So, anxiety is, it's really an emotion that is really, really characterized by feelings of tension, many worried thoughts, and physical changes like an increase in blood pressure. People with anxiety disorders generally have what we call intrusive thoughts or concerns, thoughts that just kind of come right in to your mind. And given anxiety and given these thoughts and concerns, they may avoid certain situations simply out of worry, simply to not increase their worry. Although what we find is it just does that. It just does that. It does increase your worry by avoiding certain situations. And we're going to talk more about that. So, next slide, please. Okay. I can't stress enough that once you're given a diagnosis and you begin treatment, anxiety is a normal reaction. It's a normal reaction to any type of stress or any type of trauma that you may have experienced or you are currently experiencing. And when we talk about anxiety, we're often also talking about depression. Most people who feel anxious also have a component of depression. Most people who are depressed also have a component of anxiety. They co occur. One may be more prominent and one may manifest more than the other, but they will be there together to some extent. Anxiety causes, cancer really causes considerable emotional and psychological distress. And quite frankly, high levels of distress may lead to anxiety, depression, or both. So the source of the issue really is the stress and the distress that is currently being triggered within you that will produce the anxiety and or the depression. What I'm not really talking about here is pre-existing anxiety or depression. So what that means is a mental health history of anxiety or depression that you may have had prior to coming into the cancer experience. And what I will just say about that are chances are that if that is the case, if you are coming into this experience with a diagnosis of generalized anxiety, panic disorder, or or a history of depression, chances are we're going to see a spike in that. We're going to see a spike in that throughout the cancer experience. I think it really remains important for us all to recognize the signs, the symptoms of anxiety and depression so that we can effectively treat it and focus on your quality of life, right? For optimal functioning. That's really our goal, and to reduce the distress. We are interested, the collective we, myself, my colleagues, we are interested in helping those bad feelings that you're feeling, helping those negative feelings diminish and decrease. And once we're able to do that, it really does allow for folks to have more space to be able to feel more pleasure and more joy, because these two situations of anxiety and depression really do rob folks of joy and pleasure because people are suffering. So we're going to go ahead to the next slide. So, what do we see and what do we feel specifically in the cancer setting as it relates to anxiety? So, we can certainly see and feel intense, excessive, persistent worry, worry that just keeps going, that really doesn't stop. And a lot of the voices and the tape and the thoughts in one's mind can be, oh my gosh, I've just been diagnosed with this life-threatening illness. What's going to happen to me? What's going to happen to me when I start treatment? Am I going to have side effects? What's going to happen to me? Am I going to survive? Am I going to die? What's going to happen to me? It's really a big general question that I find that most folks worry about. We also have fears around everyday situations, not only the treatment related fears and the side effects, as I just mentioned, but can I go outside? Can I see somebody? Granted, it's COVID right now, but what is it that I can do or can't do, given my diagnosis? Also, I think what's really prominent in folks that we see a lot, that we hear a lot, are just these sudden bursts of intense anxiety and fear. Some people will call them sheer panic, terror. I like to call them panic attacks. So a sudden panic attack really isn't that sudden. It's likely been brewing, but it's been a little silent in your body and in your mind. And all of a sudden, it just comes to fruition and it's a full blown panic attack. So we see this a lot with people who are just coming into the cancer center for their appointments, being at home, knowing they have a scheduled phone call with their doctor or their nurse, expecting test results, scans. Am I going to recur? Am I going to relapse? It's tremendous panic and tremendous fear around all of these really important issues. So I want to validate that very much. Together with panic attacks, we see heart palpitations, an increase in one's heart rate. People tend to sweat, they get sweaty palms. People become restless, fidgety, just really unable to sit still. Rapid breathing can happen. Most people that I work with report to me that they have difficulty sleeping, that in some way or another, their sleep becomes quite compromised. And quite often, overnight, during the night, when they're awake, whether it's 1 hour or 4 hours, they may stay awake ruminating, constantly thinking over and over again, what's going to happen to me? I'm anxious, I'm scared. And so, obviously, with all of these symptoms, with all of these signs and symptoms, it can be quite impossible to concentrate, to have some focus. So, most people have trouble in that area. We're going to go on to the next slide, please. So, that was a very brief overview of anxiety. And we're going to talk a little bit about depression right now and how depression may be manifested. So depression certainly is a common condition in any cancer-related treatment and diagnosis. I can't say that enough. I validate that for you all. I normalize that for you all. Depression may be experienced really at any point in the cancer experience, either before, during, or after your treatment. Depression is a mood disorder, so let's understand the difference. Depression is a mood disorder, whereas anxiety contains really its own broad range of disorders and categories. For example, generalized anxiety disorder, panic disorder, social phobia, agoraphobia. It has its own list of categories of disorders. So remembering that depression is really a mood disorder. And depression also very much impacts your ability to make decisions within the treatment setting, as well as being able to care for yourself, to provide yourself with the necessary self-care that you need when you are diagnosed, when you are in the approaching treatment, when you are in the throes of treatment, and absolutely when you are post-treatment. One of the things that I like to explain to folks is that, you know, it's really one of the reasons that we always harp on people to bring their best friend or their loved ones to accompany them to a doctor's appointment, or to be on the call with them when they're talking to the doctor, because the information you're anticipating some type of information and you don't know what that information is going to be, and so you're already worked up a little bit, and you're not going to hear things clearly, nor should you. You really should be able to trying to hear at best what you can. And we really want to have the other person who's with you take notes, ask questions on your behalf, and just be there to support you so you can feel that support in the moment. Next slide, please. So, like I said earlier, some of the symptoms of depression can appear right after diagnosis or any time during or after treatment. And that's really important to recognize. And also, the symptoms of depression and depression can shift throughout. We are always shifting throughout our treatment. From the moment of diagnosis, I always like to say to people, in 30 days, even in 14 days, you're going to be in a different space. You're going to know more. You're going to know your body more. Um, and so your depression, just like your anxiety, is going to shift, sometimes from week to week, sometimes from month to month, sometimes not at all. Some of the symptoms of depression, as some of you may know, include feeling down, feeling sad and blue, feeling hopeless, and often feeling a profound loss of interest and pleasure in some of the activities, hobbies that you once enjoyed. They just don't appeal to you anymore, at least at this time, during this time. Next slide, please. We also see, really big component of depression is this loss of motivation to do your daily activities of living. Showering, getting dressed, those are extreme examples, but really just being able to move through the day. There just isn't that motivation to do that. And that's because of the impact of the depression. Like we said 2 slides ago, real difficulty or a struggle in being able to make some decisions and on being able to focus. And I always tend to tell folks, let's just take it one step at a time and focus on one thing at a time. And we're going to talk a little bit about that down the road when we come to interventions. People who are feeling depressed can have a lot of negative thinking, pessimism. We do see suicidal ideation and or thoughts of being better off dead. I also, that comes with a range. When I see that in somebody, or when I'm talking to somebody about that, likely they've had either some active suicidal ideation or some passive suicidal ideation. And there is a big difference between that. Some people are feeling really the throes of the side effects of treatment, or maybe they have a more chronic form of lymphoma and they've just been through the mill and they just keep going back and forth with treatment, and things aren't often changing. They're really beginning to feel hopeless, and they may say, gosh, I, I understand why people may not want to live through this. Maybe I'm just better off dead, but they're not actually suicidal. So when somebody is talking really about not wanting to live, we really want to explore that for very obvious safety reasons and do a really thorough suicide assessment and really put a safety plan, um, and work together on that safety plan with folks. Also, one of the hallmarks of depression is not only the lack of motivation and the difficulty focusing and negative thinking, but it's also fatigue. And sometimes we really need to rule out what's physical fatigue and what's fatigue from depression. And that's a very, very common theme in depression and cancer patients, because you are going to be fatigued physically from your treatment, particularly if you've just completed treatment. And it's been a bit of an arduous haul for you. So we explore that. And it could be that you have both. You have medical fatigue, physical fatigue, and you have emotional and psychological fatigue. And we really deconstruct that and we really parse that out and offer interventions. Another hallmark of depression and anxiety, may I say, which is why they co-occur, is that folks really talk a lot about their sleep being compromised or insomnia. Gee, I'm able to get to bed, but I'm not able to stay asleep. And I wake up at 2 o'clock in the morning, and then I don't get to sleep until 4 o'clock in the morning. And during those 2 or 3 hours, I'm ruminating. I'm having persistent thoughts about what's going to happen, feeling gloom and doom. So that's really a very important area where we both see anxiety and we see depression at the same time. We're going to go to the next slide. Okay, so we've just spoken a little bit about anxiety and depression, which we see so often in people who are going through the cancer experience. So what are we going to do about it is really the question, and that's really why we're here today, to go over some of these um, emotional concerns and their impact on you on a day-to-day basis. But what are we going to do about it? How are we going to make you feel better? So one of the interventions that I personally and professionally absolutely love and have had the pleasure of and the honor of working with people for the last, well, I guess 20 years or so, is really working on something called behavioral activation. We can do behavioral activation in the outpatient setting. We have a lot more room to grow with behavioral activation in the outpatient setting, but we can also talk about behavioral activation and employ it in the inpatient setting. Its goal really is to re engage you in the world, to reconnect you, to really regain some of that motivation. When people become anxious, when they feel anxious, when they feel depressed, the tendency, right, is to withdraw from others, to really withdraw from the world and their daily activities, their daily habits. And in turn, what happens? In turn, you feel bad. And then, because you feel bad, you do less. So it's this feel bad, do less kind of vicious cycle that we're going to talk about in a second. But we want to break that cycle. That's really the goal. We want to break that cycle. Oh, how do I break that cycle? I just can't get motivated. So then I don't do anything. And then I feel worse. And then I still feel bad. So, BA, as we're going to call it, behavioral activation, really aims to help people find ways to become active again. It's just as simple as that, not so simple to put into practice. So, really, the moral of the story is that activity, any kind of activity, can begin to break the cycle of anxiety and depression. Let me stop here for a moment and say, when people's anxiety and depression is very acute, if it's very high, we may need, in order to begin BA or any other type of intervention, we may need to ask people to have a conversation and meet with a psychiatrist. And we're going to have a slide or two about psychiatry later. But sometimes that's very helpful for people because sometimes people cannot just work solely with behavioral interventions. They need a little bit of medication to kind of get them going. So that's not for everybody. But in my practice and what I've seen over the years that works really nicely for people is that myself as a social worker will work in tandem with a psychiatrist to work on these behavioral interventions, such as behavioral activation, together with them being actually treated, medically treated for their depression or anxiety. Next slide, please. So here we are. This is the diagram that I just mentioned. So I feel bad. I feel bad. I don't feel like doing anything. I'm at home all the time. It's COVID. I don't feel like reading. So I just kind of lie on the couch and watch TV. And maybe it's okay to do that for a day or so, but I want to do more and I can't. I just physically and mentally and psychologically and emotionally can't. So I do less. So because I don't do anything and I do less than I normally do, I'm going to feel bad. So it just becomes a vicious cycle. And that's where we see people really suffering the most. And so we're going to learn now how to begin to break that cycle. Next slide, please. So how does it work? Okay, let's learn a little bit about how behavioral activation works. So we do begin by explaining to people a little bit about this vicious cycle of feel bad, do less, which we just talked about for the past 2 slides. But really, what I like to do with folks is I like to sit down with people and say, okay, we've just gone through what the cycle looks like. And that's pretty well described how you're feeling right now and where you're stuck. What what are people's personal values? What gives meaning to you in your life? What are your values in terms of, do you like to help others? Do you normally, what is it that you hold near and dear to yourself? To really think about that. And what are some of the very short term goals? Maybe it's just one goal that we can think about for today, maybe tomorrow, but for today, maybe if somebody's feeling better, we can think about what are your goals for this week? What's important to you? What do you wish you could do? And we start from there. And what is your hope? Not for a year from now, because we know everybody wants to be in remission and live a full life. But what's your hope for today, for the present? We also want to adopt the frame of mind of, hey, let's take an experimental approach, meaning that even if we don't succeed at first, if I don't get to my goal because it's harder for me to, because perhaps my anxiety is still very much in the way and I need to go slower, or my depression is really a barrier and I need to go slower to accomplish my goal. Let's experiment. Let's try to see if we can get out of the house today. Because, no matter what happens, you're going to learn something valuable. You're going to learn, well, yesterday at noon, I couldn't, I got dressed and that was the most I could do right now because I got up and I felt gloom and doom and I had a flurry of negative, intrusive thoughts about what's going to happen to me. And I just couldn't. So I had to stop and I had to breathe and I just had to sit down and I had to say, okay, I've just learned from this moment. Maybe we try again later in the evening. We always want to tell people to follow the plan, right? You're going to meet with somebody who's obviously going to introduce you to behavioral activation, whether that's somebody like myself, who's a clinical social worker, whether it's a psychologist, whether it's a psychiatrist. It probably won't be your oncologist because they're not really trained in BA. So we want to follow a plan that we discuss with our patients, that we discuss collaboratively together about how we're going to try to break the cycle. Because if we followed our mood, we may never break the cycle. So we always want to follow the plan that we've collaboratively, jointly spoken about with our social worker, our psychiatrist, our psychologist. And once that plan has been formulated and talked about, we want to practice it. We want to practice it as much as we can in session with your provider and outside of the session. This type of a behavioral intervention requires practice. Okay, we're going to go on to the next slide. So let's talk about what we mean by identifying your values, your hopes, your dreams, your goals. What have been your values in life? And how has your diagnosis informed change in your values? These are your values and yours only. These are not what other people have told you they should be. And I say that because we I see so many people every day who say, well, my mother thinks that I should be doing this, that this should be important to me, that that should be important to me right now, not that. Um, so I hear that all the time. I work a lot with young adults in their 20s and 30s and 40s, and their spouses, their parents, their significant others feel that. Um, I work with a lot of folks um, who say, "Well, my husband says, I really need to focus on eating, only eating, and then getting a 45-minute walk in every day." And I don't want to do that. I don't think I can do that. So we really need to put those people on the side for a minute and hold them lightly. And we need to think about there's been a change in me. I'm going through this treatment, this diagnosis, this experience, but I really want to achieve something. I want to be able to do something to break this cycle of anxiety and depression. I want to be able to get up and go for a 15-minute walk every morning, every afternoon, and every evening. So that's something that I work a lot with folks, and we can use that as an example. I can't do a 45-minute like my mother wants me to do, but I can maybe squeeze out 10, 15 minutes 3 times a day. So that's one thing, remaining healthy and active, getting out for a walk. I I want to have a better relationship with my spouse, with my children, with my friends during this experience. I still want to remain connected in terms of a social life, even through COVID. How can I do that? I do want to re-engage with some of my interests and hobbies despite the restrictions placed on me. And, my mind, my body, spirituality, or prayer, these are all things that can be important to people. People want to be able to re engage in self care practices because it's lapsed because they're too anxious or they're feeling too down or sad to really be able to employ some of those things that they used to do. Taking a warm bath, taking a warm shower, using their special shampoo or body lotions. People often neglect those things through this experience. So, what we want to do, and what is a really big component of behavioral activation, BA, is to be able to sit with our provider and really begin to look at a planner or a calendar and say, hey, I'm going to try to schedule some of these activities, either from the list that I've just identified above or other things that are important to you through your discovery and exploration of your values and your goals. And I'm going to follow this written plan. Again, I'm going to follow this plan, not my mood. And if I get stuck, then I'm going to reach out to my social worker, my psychiatrist, my psychologist, my team. Next slide, please. So, the way in which we do this is we break down your values and the activities that you want to do into the smallest necessary steps. We have to start small because you are already feeling somewhat compromised. You're feeling very overwhelmed, very anxious, or down and blue. So, we want to start small so we don't overload your system. And one of the things we like to do when we're talking to people around their values and things that they once enjoyed, but they want to be able to try to accomplish on a daily basis, is we look at your past. What have you done well in your past? Um, you know, what has been really difficult, but you've weathered it, but you've struggled, but you've gotten through with help or on your own? Because if we focus on past successes and we use that as an example, granted, it may not have been something that you were able to conquer and manage in a cancer experience, But those past successes can help. We can use them as a little bit of a guide and an analogy. And it is often helpful because it will make people think, oh, yeah, that was a really tough time, different than today, but I was able to manage it. So, what are the values? What are they specifically? What do you want to do specifically? Where are we going to help you do them? Are we going to help you get out of your house and just sit on the porch and just feel some fresh air because you've been cooped up all day today? Um, when are we going to do this? When should we plan to do this for you? Oftentimes, you're the expert around that because you know how you're feeling when you get up in the morning. So you know if mornings are better for you, or perhaps if after afternoons are better for you, depending on what medications you're on, what side effects you're experiencing. So, as you can see, we really have to drill down and really explore what is going to be most helpful for you on a daily basis. We also want to ask, who are you going to do this with? If you're feeling fatigued, if you're feeling unsteady, we might want to have you ask a buddy to help you out. A friend, a family member, someone you're living with. So I always like to use the example that I've just been talking about a little bit of getting out of the house. And when I work with people, often or not in this situation, they have gone through a fair amount of lymphoma treatment. They're feeling relatively unsteady. They're feeling down. They've been quite anxious about whether or not they're going to get into remission. The 4 to 6 cycles of chemotherapy, are they going to help me? I don't know. So we ask them, so what's it like to get up in the morning? Okay, it's actually pretty okay. And I can actually get dressed, but I'm getting a little panicky getting out of the house because I've been home so much. It's safe. So, how can we get you out of the house? Well, okay, you're dressed. Maybe we'll put on, maybe all we can do today is get dressed and put on your running shoes and lace them up. And maybe all we can do today is do that and make it to the door. But we actually don't open the front door. Maybe we just stay home and we say to ourselves, that was my experiment today. I got up, I got dressed, I put my shoes on, just couldn't quite make it out because I was feeling a little too anxious. You know what? I'm going to try it either later on or I'm going to try it tomorrow. That was my experiment. So really encourage people that no matter what it is that they want to do, that this is an experiment. We're going to try to see how I did today. And it's not your fault that you couldn't get out of the house. It's not your fault that you couldn't get that goal fully completed for the day. There's no point system here. There's no judgment here. This is starting very small at the very beginning because that is how we're going to get further along the road. I think if any of you are listening and if any of you have been through either an autologous stem cell transplant or an allogeneic stem cell transplant, you know how depleted you might feel, and you know how important it is to move, to get some movement in, and um, and it starts small. You start small. Many of you are living with worry, are living with some sadness, and you want to better your situation, but it can't happen overnight. If you remember the Nike slogan, just do it, that is not applicable to this situation. And I want to encourage people, I can't say it enough, to not put any judgment on themselves. There is no pressure, there is no timeline. We start where you're at. So the wrong turns are often helpful. Why? Because we learn where we're at on a given day. And if you've ever conducted an experiment, you know that you always learn from experiments. So, this idea of an experiment, I hope, can help people see that this is a judgment free zone that just simply doesn't exist in this scenario. Let's move on to the next slide. So while we're employing behavioral activation, we start maybe the next day, we're able to get out of the house and sit on the porch. And maybe the day after that, we're able to walk up and down the block. And then maybe after that, we get up to 10 minutes of walking 3 times a day, twice a day. Eventually, people find who enjoy this activity is they're able to, once they're successful with a little bit of the activity, they're able to feel much more successful with, you know, upping their time to 15 minutes, 20 minutes. But at first, we start small. So we want to continue to monitor and assess at every turn. We want to apologize for that. We want to continue to monitor how you're doing. That is part of the behavioral activation treatment. How's it going this week? What were you able to accomplish this week? How did it feel? How was your mood? How was your anxiety? How did it feel in the moment? Okay, it was a little too overwhelming to do that. Okay, let's back off a little bit. Let's see how, let's practice some breathing exercises. Let's slow it down a little bit. Okay, you're feeling great and you're able to do more. Great. Let's see how you're doing with a little bit more. So that's part of our ongoing monitoring and assessment. We never just explain an intervention and then leave you to do it. We're sticking with you in this. We are continuing to check in, if not daily, then weekly, around how this is going for you. And, one of the other things that can help people keep on track too is expressing your intention and expressing your plan to another person, somebody in your household, a friend. Maybe it's your lymphoma buddy that you've acquired through one of our organizations here. So that can help you feel motivated, can help people feel accountable, although we don't want to put a lot of pressure around that accountability. But also it can help you feel a lot more encouraged and less isolated that you've told somebody else. So maybe that other person can call you and say, "Hey, how'd it go today? Did you find that you were able to do something today? Anything at all? Okay, great. So glad you were able to do that. What did it feel like? All right, you weren't. This evening's another time frame. Tomorrow's another day." Next slide, please. I'm just going to wait to get to the next slide. Great. So during our ongoing monitoring and ongoing assessment, we're always reassessing how people are doing because we want people to feel better and to get better. So if something isn't working, we want to, either switch gears or try something a little bit different. But one of the things to continue to ask yourselves is, gee, what situations may increase my vulnerability or my susceptibility to depression or anxiety? What is it? Is it just driving by the cancer center? Is it walking in? Is it meeting with my team? Is it getting chemo? Is it trying to do one of my BA activities? What is it, listening to all my friends who are doing such fantastic things with their lives and I'm not? What is going to increase that? Another way to think of it is what's going to trigger my anxiety or my depression? And also, what behaviors contribute to keeping the depression or anxiety cycle going, right? That whole cycle of feel good, feel bad, do less. And what behaviors increase and what behaviors decrease my depression or anxiety? So what do I need to do to maintain my momentum here? And what can I do to increase the chances, and this is really important, that I follow through on my helpful behaviors? So we're really talking about here are, what are my triggers? What are my reactions? And what are my avoidance patterns? What am I avoiding and procrastinating on today? So these are things that we want to keep in mind in order to help the behavioral activation process along. Next slide, please. Okay. So behavioral activation often can go hand in hand with what we all know, and the world is really talking about mindfulness. What is mindfulness exactly? People think it's only meditating, and it is a form of meditation. It's a type of meditation in which you focus on being really intensely and acutely aware of what you're sensing and what you're feeling here in the moment. Again, without interpretation, without pressure, and without judgment. And practicing mindfulness really does involve breathing methods, guided imagery, and other practices to relax the body, relax the nervous system, and the mind. And what it does do is it does help reduce the stress. Next slide, please. Mindfulness encourages us to do a couple of things. It encourages us to understand how one thinks, how you think when you're under stress. It enlightens us how we react and respond under stress. How are your thoughts? How are your behaviors? How are they different when you're under stress as opposed to when you're not? What do you really have control over? And what do you not have control over? And that's a really big one. What can you change in this experience? What feels like you can't change in this experience? So you have to learn to adapt to. What are your sources of stress? Is it your diagnosis? Is it your treatment? Is it family members who are telling you what to eat, what to wear, what to do, how to behave? A lot of times it is. Is it work? Are you just filing for FMLA? Is it finances? Um, are you worried about not securing your job, not keeping it? Are you worried about being fired? All of these things play into um, stress and anxiety and depression. And what are your relationships like? Do you find that they perhaps have suffered a little bit throughout this cancer experience? Are you worried about people dropping off and not supporting you? Or have too many people come in, and are you feeling overwhelmed and not knowing how to, have a little boundary around that? So really important to consider all of these, and really important to learn your own stress signals. We all know that tension, inability to concentrate, headaches, muscle tensions, tension headaches. And really, people can get pretty grouchy and pretty irritable and angry under stress. So that's often a sign. Next slide, please. So, in mindfulness, we always want to teach people about breathing techniques and diaphragmatic breathing, which is a daily practice. Putting one hand on your chest and one hand on your belly, and it really monitors the diaphragm and your breathing, where really only the stomach, your lower belly, is moving. So it really slows your nervous system down. It really slows your breathing down. And I do this with people, and my colleagues do this with people every day, all the time. It's really inhaling deeply and slowly from your nose and then exhaling through your mouth. We always like to teach people about the calm reminder. Your chest, breathe slower, breathe deeper. Your arms, your shoulders and your arms, let them drop, let them sag. Your legs, make sure they're loose and flexible, shake them out a little bit. And we hold a lot of stress in our mouths and our jaws. So we really want our jaw to just drop and really fall into this calm reminder. Next slide, please. These are some of my best resources around mindfulness based relaxation techniques. And I hope that you can all benefit from them. Um, the psychologist that I work with is also a really big fan of these. And I want to just draw your attention to the bottom, which is the UCLA mindfulness meditation. It has a dozen or more mindful meditations for every situation you can possibly encounter. So it's really one of the best resources that I have found. Um, and I also want to let folks know that these are free. I believe they're all free. But there's also, next slide, please. I think I have the, yeah. So there's also two other apps that I would highly recommend, but they are, you must pay for them. One is called Breathe, Breethe, and it's wonderful. And the other is called Insight Timer. And I have a lot of people who use those two, and you can download them right on your phone. There's also Headspace and Calm, and I think those are free too. So, the role of psychiatry. Talked earlier a little bit about psychiatry, and we work hand in hand with psychiatry. So, psychiatry can definitely contribute to to the prevention, the recognition, and the treatment of emotional distress. Medication management can offer a tremendous benefit to people, as can psychotherapy. And today, many of our psychiatrists do both together. They do both psychotherapy and medication management with close follow up. I think that if a psychiatrist is going to start you on a medication, I would say that within 2 weeks they should be checking in on you in terms of, your response to that medication. And one of the things that is really good about meeting with a psychiatrist in a cancer setting is that our psychiatrists really do require a good understanding of cancer and the working relationship with other oncology colleagues. So it's a real big benefit. They see lymphoma patients, they know the chemos, they know the adverse effects. So I always like to have people come to my center, to our center, to see psychiatry because they do have a greater knowledge, I would say. And they are very much a crucial part of the team. So, yeah. Next slide, please. Spiritual health, as they're called where I work, or chaplaincy as they're known, really provides respectful spiritual and emotional care. And I would say to people of all faiths, they do a lot of active listening and really supportive companionship. They will walk this journey with you. Yeah, and they're very collaborative. Next slide, please. So during COVID, this pandemic has remained really, really remarkable. We want you all to have every resource possible and accessible to help you during this incredibly challenging time. And I think for many people who are diagnosed with cancer and living through the cancer experience, treatment is carrying on as usual. There has been a little bit of a drop here and there, but treatment is carrying on as usual, which really makes people feel very fearful of catching the virus because you do have more of a compromised immune system. Your immune system is more fragile. I would say limit the news because news headlines can be really scary and really debilitating. And COVID has really increased anxiety. Next slide, please. Would really want to normalize your anxiety during this COVID experience. You know, I think that leaning into the strategies such as behavioral activation and mindfulness techniques can be incredibly helpful to ground you. We want to really look at grounding techniques. Many people who are going through cancer are already accustomed to remaining at home and are accustomed to restrictions, but it doesn't mean that this COVID experience has been easier for them. That's a little bit of a myth. It means that they may have a little bit of a training ground, but this adds an additional layer of complexity and struggle for people. Okay, next slide, please. So we really want to stay connected because there's a great deal of social isolation, and we really want to be proactive. proactive. What can you do? Can you do a Zoom call? Can you do a FaceTime? Can you Skype? Can you join a support group? Next slide, please. We really want to help people find those moments of pleasure and joy, either if it's through another intervention or through the interventions that we discussed today. I also want to encourage people to just have a day. Take a break from all of these interventions and have a day if you need to have a day on the couch. Schedule a telehealth session with your community providers, with your cancer center social workers, and check in and all the time. If you're not feeling well, please check in with your healthcare team. Next slide, please. Our holidays are upon us, and holidays are made up of moments, and we really want to take the time to consider, what is important to you in your holiday. What's the meaning of it? What's your belief? What's something small and positive that can be added to you this year? And what kind of memory do you want to create? A lot of people are telling me they're creating a COVID Christmas. Next slide, please. So just really helpful tips for coping overall is to really set some boundaries and prioritize your coping in adaptive ways. Acknowledge how you feel. Communicate your needs to your family members, to your medical team. I can't stress that enough. Really differentiate between what gives you peace and what your obligations are to yourself during this time. Know that there's no magic formula and reflect on really what matters to you. And I know that we're out of time, but I hope we can have just a few more moments for questions. Thank you.